The health of residents right across Liverpool is of real vital importance to the City Council and this administration. And at the next full council meeting, we'll be particularly focusing on the state of residents' health in the city and how we need to address some of the particular challenges we've got here in Liverpool over the years ahead. The current situation is quite stark and is quite difficult and quite challenging. It's completely unacceptable that in some parts of the city, life expectancy is almost 15 years less than other parts of the city. Often, this is down to poverty and deprivation and lots of historical factors. But the new research that we'll be looking at also shows that in more deprived communities, not only are people living less longer, they're also experiencing longer periods of ill health as well. All of that is completely and utterly unacceptable and something we've got to tackle for the good of the people of our city. So what are we going to do about it? Well, there's lots of different things as a council we're focusing on. We've got £5 million of funding from the National Institute of Health Research to focus on the actual data, so all of our decisions going forward can be based on the equity of people's health right across the city. Lots of other elements as well about how we're focusing on children's health and our programme for healthy children that we're going to be rolling out through our network of family hubs. How we focus on making sure people have got access to healthy food right across the city with embedding our healthy food strategy. Looking at the services, working closely with the NHS that are available to people across the city, and particularly focusing on mental health services. Equally as well though, it's not just about the things that we as the City Council are going to do. There's huge challenges here. We need government to step up to the plate with us. We do need a multi-year funding settlement, not just for the council, but particularly for the health service, so we can take a proper strategic view of delivering the services that people need here in Liverpool. But equally as well, actually, why can't we here in Liverpool, right across the Liverpool city region, have some of the devolved public health powers that the Scottish Government and Welsh Governments have been able to use so importantly? Things like minimum unit pricing of alcohol, things like the potential of a takeaway tax, the ability to ban disposable vapes, that opportunity to take some local control of doing more prevention being better than cure approaches. It's all of those different things that we need to focus on so we can address some of the real significant and unacceptable health disparities here in Liverpool.